I've been working at the Boulevard for several years, but now more than ever, after a year of fighting the COVID pandemic, I have come to understand that it isn't necessarily the doctor's visits or the medications that really make a difference for our residents. Instead, the most valuable thing we can provide is a secure and reliable place to rest at night, and the case management services to bridge our residents to more permanent housing. Studies show that people experiencing homelessness have higher rates of illness and die on average 12 years sooner than the general US population. But now with the constant threat of COVID, even temporary relief at a shelter or doubling up with family can be risky, since congregate living automatically increases the risk of COVID transmission. Without permanent housing, we can only shield people from COVID and other health risks to a certain degree. The ultimate solution is a system in which we understand that housing is healthcare, and we fund the programs that will end homelessness once and for all. That is why CHHRGE stands firmly behind the Bring Chicago Home campaign and other measures that will provide funding to decrease the number of people in our city experiencing homelessness. We know that healthcare services are most effective when patients are stably housed. In fact, studies have shown that when cities choose to provide housing for their vulnerable populations, the healthcare savings exceed the housing costs. Let's give this problem the attention and funding that it deserves, and by doing so, make a life-saving investment in the health and well-being of our communities.